Hey, ReMar nurses. It's Saturday night. I'm popping up live. I told you guys that I would to do some more Nclex questions. We had such a great time during How to Pass Nclex Monday session. Who's rocking with me Saturday night? Listen, my baby's asleep. I don't know how long I'm going to be able to stay on here. My kids are down, and if you're like me, we got to get our studying in when we can get our studying in. So who is with me? Do I have Florida in the house? I see you. I see you guys. Come on in. We're about to do some Nclex questions. I got a presentation prepared for you guys. So I hope you appreciate it. It feels so good to be able to just pop in and study with you guys on this Saturday night. I can't believe we're studying Saturday night, but we got to do it. 2020 is about to be over, and I just have to get this in for you guys. So we're going to be answering an Nclex question that I had, and I've been getting this one very, very regularly, right? People are always saying, I emailed you. I want to know what is the answer to this. So here, I'm just going to give you the most common one I've been getting. Shout out to the Bahamas in the house. Shout out to Florida in the house. Repping ReMar nurses, my best friends. We're always studying. North Carolina in the house. I can't wait to get to North Carolina. Who else do I have? Detroit. Shout out to Detroit. Shout out to Chicago. Also, I know my international nurses are here from all over. Come on in. We're about to do some Nclex questions. These were my favorite ones that I've done. So if you have seen them, you probably haven't seen them before, but if you have seen them, you're going to love them. New York, what's up? Georgia, Virginia, I love it. Florida, as always. Puerto Rico, are you here? Jamaica, are you here? Miami, can't wait to get there soon as well. Orlando, yes. Come on in. Tell me where you're from. Smash that share button because I need all of the ReMar nurses to know that on Saturday nights, it's very likely for me to pop on here and get to studying with you guys. So a lot of nurses in the family now, this is what we do. We're all about getting our license. If you don't have your nursing license, this is where you need to be right now. Virginia in the house. I see you, Hope. How you doing? Marcella, Mayo, Florida, always. Renee, Louisiana. Yeah. Come on in. All right, so let me get started. Welcome. I got this question by email, and it was simply this. I've been seeing this so much. There's so much confusion. Has the Nclex changed? You guys know the answer to this, right? And I think there's a lot of confusion because of the COVID testing procedures and protocols, but for this question, and tell your friends this as well, the test has not changed, okay? The test plan has not changed. The passing standards has not changed, all right? Passing standards has not changed. So if you are taking the Nclex exam, it's going to be as difficult as it always is, and the topics are going to be the same, okay? Now, all of the topics that you have been studying are going to be on the exam, okay? So again, that test plan is not changing. Now, what has changed and what has frequently changed is these modifications. So remember, starting in October 1st, 2020, what they did was they reintroduced the pre-test questions, okay? So the 15 pre-test questions they have introduced. And so that means that, essentially, that means 15 of the questions that you get on your Nclex exam won't count. So you will not know if it's a pre-test question or not. What I do is I just tell you guys, if you get a question that you have no idea about, you didn't study it, you never seen it before, chalk it up as a pre-test question. Don't even worry about it. Don't even stress yourself out about it. Just answer it the best of your ability and keep it moving, okay? Also, so the minimum questions that you will have on your exam, whether you're RN or PN, will be 75, okay? Now remember, 60 of those questions won't count, but you'll have 75 as a minimum and 145 as a maximum. All right, so be prepared to answer 145 questions, period. Be prepared to answer 145 questions. All right, the examination time will be 5 hours. and they are reintroducing the voluntary next generation special research section. Okay, and that's optional. You don't have to do it at the end. You can if you want to, but you don't have to do it. And then also the Nclex tutorial. The Nclex tutorial is going to be removed for general test taking tips. Now I see some people saying like, they don't tell you the research section is voluntary until at the end. All right. So I'm just telling you now up front whether you want to take it or not. Shout out to the nurses coming on here saying that they passed with ReMar. I appreciate you guys joining me. And I want to address this too. I know that a lot of testing centers have said that they have no more test dates for the rest of the year. And that is so very sad. That is so sad. As much as we need nurses, they have not figured out a way to accommodate the need for people to test. It's outrageous. It's outrageous, right? But COVID really exposed how prepared or unprepared businesses are for flexibility. So a lot of you guys will not be testing until 2021. Yes, sad but true. Sad but true. So it's just like those who were testing in March, and remember in March, everybody's test date got canceled, like March and April, and they had to wait until like June or July. The same thing is happening again. And anybody who's preparing for Nclex, be prepared for this to happen. It's so annoying, like, because they cancel your test dates and then you can't get hold of the boards of nursing. They're working at home. Nobody's answering the phone. You don't know if you failed or you don't know if you passed. This is just the state of nursing licensure right now for everybody, like everybody, right? And so we're all in this together. I get a lot of emails with people saying, can you help me find out if I passed, if I failed? And it's a bear trying to get a hold of the state boards of nursing, even the really good ones, So some people are saying they're going to test in January, February. Yes, I mean, if you get a test date, jump on it, but don't be surprised if you're not able to test, all right? So what I need you guys to do is keep it locked in here, because any updates that I get, I'm going to share with you guys. Plus, I am committed to keeping you studying during this time. Just because you're not testing until January, that doesn't mean you can take off. That doesn't mean that you can just sit around and like kind of, placate this thing. You got to be on the grind, because if you don't use this information, you will lose it. Seriously. If you don't lose it, you will, if you don't use it, you will lose it. All right. So we have to be committed to the process. All right. This is your license. Nobody else is going to take responsibility for this but you. If you don't want it, trust and believe. The state boards of nursing, they're doing all they can, but it's your responsibility to make sure that you're up on that paperwork and up on looking for them test dates. All right. So this is what it is here for you guys who will be taking the test, who were able to get a testing date, who were able to lock in. All right. Who were able to lock in to a testing date. But it's going to take time. It's going to take time. All right. It's going to take time for us to get there. How long does a person need to study for? Typically, to prepare for Nclex under non-COVID situations, it's a 6-week process. However, during this time, it may take you 2 weeks. It may take you 8 weeks. It may take you 12 weeks. Everybody is different. And it absolutely starts with what you know as a foundation of nursing. And with ReMar, we have such a diverse community where we have international nurses. We have nurses that's been out of school for 10 years. So you know, if you've been out of school for several years, that it may take you a little bit longer to prepare for this test. Or if you have just graduated, it may not take you as long. Okay, so everybody's different. You have to evaluate where you're starting from. I'm going to show you guys some questions. And these are really med-surg basic questions. And I think if you can follow these questions and pick these answers, you have a good foundation of nursing. If a lot of this stuff that I'm about to show you, and it's just a couple questions, if they don't seem familiar to you, then you got some work to do. And when you study with ReMar, it is not, I make it as simple as possible. I make it as simple as I can, But you know, if you need to put in some background work, you got to be responsible for doing that. I think people come with the expectation that whenever you study with me, that I'm doing most of the work. That's not true. You have to do most of the work when it comes to preparing for Nclex. I can come and I can present a beautiful lecture to you, but if you're sitting there taking notes and you're writing down words you don't understand, and you're writing down, numbers that you have no idea what the reference is for, you have to make sure that you go back and look that stuff up. The only way that you're going to learn is if you look it up, not if I tell you, not if I just give you every answer. So that's a misnomer that people have. This is not a memorization test. This is not a memorization test. All right. It's not a test that you took in nursing school at all. At all. This is an exam that you've never seen before. You've never prepared before. Even if you have taken the exam before, you're going to get a whole new one when you test again. So it's best that you prepare for it like you've never taken it before. All right. With all that said, I am going to show you the first question. Here we go. All right. Let me see if I can do this. All right. Question number 1. Here we go. A practical nurse is working on an adult medical surgical unit. There are no more available beds, and current clients must be sent to the pediatric unit for care. Which of the practical nurses is most appropriate to transfer? Which of the practical nurses' clients is most appropriate to transfer to the pediatric unit? Okay. Number 1. The client with an acute urinary tract infection, the client with an acute chest pain, the client diagnosed with prostate cancer, or the client with glaucoma. All right, here we go, guys. This is a great question that encompasses it encompasses what? It encompasses med surg. It encompasses pediatrics. All right. And critical thinking. Who can we transfer? People are saying 4. Okay. Well, and what I want to say to you guys too is I'm going to show you questions. I'm going to show you these questions, but you have to make sure that you're reading them correctly. Reading is half of the challenge that some of you guys face. The Nclex is a very low, like an 8th grade reading level, supposedly. All right. So you have to make sure that you're reading what you need to be reading, because I see a lot of wrong answers. Okay. And I don't know if you're answering the question I'm asking or if you're answering your own question. So here I'm asking, who needs to go to the pediatric unit? All right. And consider this. If you send somebody to the pediatric unit, what kind of nurses are going to be there? All right. What kind of nurses are going to be on the pediatric unit? That's all I'm going to say. All right. So let me show you the correct answer. The correct answer is going to be, tap your phone if you can't hear me. The correct answer is going to be number 1. Okay. The correct answer is going to be number 1. All right. We want to send the most appropriate patient for those nurses to them. All right. We don't want to send patients who will be unfamiliar diagnosis or treatment down there. We want to try not to do that. We want to try to send the most appropriate patient to the unit. So if there's only going to be pediatric nurses, we want to try to find the condition that could possibly be seen on a pediatric unit. And here, if we're looking at the choices, number 1 is the only one that kind of makes sense here. All right. Urinary tract infections. Do kids get those? Yes, kids get those. Acute chest pain. Are you going to have that in a child? No, not so much. Not over urinary tract infection. What about prostate cancer? I saw some people pick 3. Are we going to be dealing with prostate cancer on a pediatric unit? If you pick that, or if you pick number 4, what is glaucoma? Do we know what glaucoma is? Do we know what the risk factors for glaucoma? Okay, if you have quick facts, you know that glaucoma is featured in the quick facts for Nclex. And my quick facts for Nclex is upstairs. But so here's the thing. You got these conditions, all right? If you chose number 3 or number 4, you know what the exam is going to think? They're going to think, well, this is a person that has not correlated glaucoma with its correct risk factors. This is a person that is not familiar with this topic, a very common diagnosis in the population. All right. So if you choose number 4, your passing mark is going to go down, and this is going to be flagged as a topic that you don't know. Okay. And glaucoma should never be, all right, should never be flagged as a topic you don't know because it's so common. It's so common. All right. All right. So get in. Okay. So this is what we're doing right now. We're going over these questions and we are seeing where we're at. Okay. We're seeing where we're at with our content knowledge. If y'all don't have the virtual trainer, you need to get it. You need to get it. All right. This is the time. This is the time. All right. Here we go. Yes. Geriatric patients usually have glaucoma. Exactly. So we don't want to send them to the pediatric unit. I'm going to do another question. There's a lot of you guys here. Shout out to ReMar nurses studying on a Saturday night. I love it. All right. Question number 2, ReMar nurse study group. Here we go. Which client should be seen first at the start of the shift? Very simple. Number 1, the client scheduled for abdominal surgery at 9 a.m. 2, the client who has a blood glucose level of 64 at 7:30 a.m. Okay. 3, the client who reports a headache 5 out of 10. 4, the client with an arm cast placed the night before reporting numbness in the fingers. Who do we need to see first right away? Who do we need to see first right away? Okay. All right. You guys are doing it. Studying, it's right here. You caught me live. Congratulations, you caught me live. You have the notifications on. You did it. All right. Okay. So I think, well, we have a little mix. We're 50-50 split, looks like. 50-50 split. All right, I'm going to show you the right answer. No surprise. No surprise. All right, I just talked about when the Nclex was changing. Oh, we missed it. All right, watch the video again if you just are joining. All right. So the correct answer here, guys, is going to be number 4. Number 4 is the correct answer. Why is number 4 the correct answer? What could this possibly be? Have an arm cast. It's a new arm cast. Yes, I see you. Dessa, you got it. What could number 4 be? All right. Yes. So number 4 is definitely a medical emergency. Blood not circulating. Yes, blood could be trapped. Circulation is cut off. This is also known as compartment syndrome. Yes, you got to know that. All right. Anytime you see cast, you best to correlate it with compartment syndrome. Excellent job. And that's a medical emergency. You got to get that cast off right away. Hey, it's Saturday night. And because we're nurses, on a Saturday night, we're talking about compartment syndrome. All right. You want to make sure that you know compartment syndrome, why it happens, what's the treatment, and what is your responsibility as the nurse. All right. How do you prepare for the medical interventions for that patient? All right. Good job, guys. I don't know why I put that on. All right. Number 3, nobody picked number 3. The headache is not life-threatening. Some people did pick number 2, and I reckon you picked it because of the blood glucose level being 64. Yeah, that's low, but it is not life-threatening. And I want you guys to think about anytime you see an abnormal number, think about if you can anticipate the treatment, right? So if we have a blood glucose level of 64, that's not life-threatening because the treatment is going to be what? Right? It's going to be get the patient to try to eat something, right? So the treatment is food. So is food going to be a priority here? And then number 1, abdominal surgery at 9 o'clock. from the information that we have, this is not an emergency situation right now, okay? Congratulations if you got it right. Yeah, so the person number 3, they have a headache, right? So a headache pain, and they're reporting it 5 out of 10. So again, if we're looking at where do I need to go right away, that is going to be number 4 over everybody else, okay? Number 4 over everybody else, because if you pick for Nclex, that you're going to evaluate a headache and get pain medication for a headache while your person in another room is potentially losing a limb, then they're going to say, this nurse doesn't know about prioritization, all right? And prioritization falls under what? Management of care or coordinated care. These are the largest topics on your Nclex exam. You have to get these questions right. There is no excuse, especially when they're as easy as this, okay? They're as easy as this. The blood glucose levels, I want to go back to number 2 just really quickly and say something else about blood glucose levels, because Trisha, shout out to you. You passed your Nclex October 17th. Congratulations, girl. All right. So I want to say this about blood glucose levels. So whenever we see a blood glucose level, especially for us who are not really familiar with clinical care, we tend to get in arms up in arms about blood glucose levels because, we think of blood sugars is a big deal. You have to take insulin for hyperglycemia. It's a big deal. However, clinically, diabetes mellitus is not something that you die from acutely, okay? In other words, people who have high blood sugars rarely die, okay? I have had a patient who has had a blood sugar of 1,400, 1,000, 800, okay? And they're living, okay? They're living. And on the other end, you can have a patient who has a blood sugar of 60, 50, and you treat them with what? Dextrose, right? And so patients who have diabetes mellitus type 2 and who have chronic diabetes mellitus type 2, they are rarely your priority for Nclex. People who have diabetes for a long time, they'll tell you, like, I feel my blood sugar dropping right now as we speak. Have you ever had a patient like that? Where they're like, my blood sugar is 60. My blood sugar is less than 60, because they know it. And they're used to it being like a certain level. And then you have patients who, who said, I know I'm gonna eat this piece of cake and my blood sugar is gonna go up to 315. And for us as new nurses, we're like, 315, oh my goodness, that's an emergency. But clinically, the patient is going to be hemodynamically stable, okay? All right. Candace says, mine was over 800 because of COVID. Okay. Candace, we're praying that you are feeling a lot better and you're doing well with COVID. All right. For sure. But yes, you are verifying that you can have an extremely high blood glucose level and not be the priority for Nclex. Okay. If there's somebody else who is more unstable or acutely affected. Okay. All right. So I hope we're all clear on that one. I'm going to give you some more questions. I know you want them. I know some people are just coming in like, Regina, what's going on? We're studying. Okay. All right. Question number 3. Let's do some more. Okay. Here's this one. I like it a lot going on. A client with a history of drug abuse is admitted to the medical surgical unit. The client has a bleeding diabetic ulcer with poor circulation. During evening rounds, the client becomes confused to time and place and attempts to get out of bed in an unsafe manner. The charge nurse recommends a chemical restraint. Which is the first action by the nurse? Is it number 1, obtaining the vital signs every 2 hours? 2, obtaining a capillary glucose level? 3, applying a vest restraint for safety? 4, administering a sedative medication? Here we go. What is the correct answer? It's a lot going on here, guys. All right. I'm going to let you read it on your own again because reading is fundamental, okay? All right, I'm going to let you read on your own again, and I want you to put the answers. I'm about to go get a glass of water. This is a long scenario. You got to read it and pick the answers. All right, I'm back. All right, I see here, I see here a lot of people are picking, number 2. What do you guys think? You guys think it's number 2, huh? All right, we have a client here. Everybody's picking number 2. Okay, so let me reveal the answer to you guys. It is definitely number 2. Yes, I really thought I could trick you guys. All right, so we had here, they had a client with a history of drug abuse, and they were admitted to the medical surgical unit, but the client had a bleeding diabetic ulcer. Okay, so we also know that the client also has diabetes, although it wasn't initially made known to us. Okay, so it says that during the rounds, the client becomes confused to time and place, right? And they try to get out of bed. So are we going to relay this confusion to drug abuse or a history of diabetes? All right. So the charge nurse recommends a chemical restraint. And I really thought that that was going to trick you guys. Well, I see maybe it is because I see some people answering later. But the correct answer would be to get that blood glucose level because the client is becoming confused, which is related to diabetic complications, right? So hypoglycemia, right? Hypoglycemia, hyperglycemia. We don't know, but we need to find out what that blood sugar level is. You got it right, finally. Yes. Okay. Great. All right. Not a lot of people, but I see some people pick number 1, taking the vital signs. Right now, we don't need to take the vital signs. That would not be helpful to us. All right. We have to understand what is going to keep this patient safe. All right. Even though the charge nurse said give a chemical restraint, let me say this to you guys, because that's a good distractor. Even though the charge nurse said put a chemical restraint on the patient, even if it would have said a physical restraint, for the Nclex exam, when patients are confused, that is the last option that we pick, okay? We never pick restraints as a first option. There is always something you can do. What are some other things we can do for a confused patient besides restrain them? What are some other interventions that would be Nclex appropriate for our patients? Because let me tell you something. Restraining somebody who is confused is going to be a straight way to injury, okay? They are not going to be safe in those restraints. If you put a wrist restraints on them, they're going to tug and pull, they're going to scream. You also need an order for a chemical restraint, right? Which we don't have. But what I want you guys to tell me is what are some things that we can do for safe patients, okay? For confused patients, I mean. What can we do for confused patients besides put them in restraints? Because for Nclex, that option is going to be wrong. It's not going to be right, all right? Yes, we can reassess them. We can redirect them, but if somebody is confused, that may not allow you to leave the room, okay? Yes, there are some things that we can do. So speaking to them in a calm manner, that's great. But a one-to-one sitter, yes, okay? There are sitters, moving them closer to the nurse's station. These are things that we can do. Redirect, distract. These are things that we can do besides restraining, okay? Hardly ever are we going to pick restraints for Nclex. So be careful, be mindful of that, guys, okay? Also, administering a sedative medication, again, that is a form of a restraint, okay? That is a form of a restraint, and there is no order in place to do that. We don't want to chemically or physically restrain our patients without trying every other option to keep them safe, okay? So one-to-one sitters, staying with the patient if you can. Share this video, guys. Share this video right now. Smash that share button. And while you do that, I will be getting ready for the next question. All right, are you guys having a good time studying? I hope you are. I hope on Saturday night, you're like, yes, I don't want to be doing anything else in the world but this. All right. Let's move on. Let's move on. All right. Question number 4. Here we go. All right. The nurse is caring for a client with a pro-brain nutrietic peptide, also known as pro-BNP, of 900. Come on, y'all. Which is the priority intervention? Gotta love these lab IUs. Shout out to Gabe, pass the boards to ReMar. Praise to God. Yes. Okay. All right. So we got a pro-BNP of 900. What is the priority intervention here? Number 1, administer oxygen 3 liters per nasal cannula. 2, administer inhaled albuterol as prescribed. 3, document the clinical data and withhold all medications. 4, administer furosemide 100 milligrams stat. Okay, here we go. Elaine, shout out to you in the Philippines. It's Sunday over there. It's Sunday over there. Kathy was already studying. All right. All right. Well, we joined your party, Kathy. We joined the studying party. Here we go. I'm talking about the pro-BNP. Yes, sir. What do you know about it? Shanita on her way driving somewhere. You going somewhere on Saturday night doing Nclex questions. All right. Okay. So again, Suzette, I'm studying, but I'm a former ReMar student. Have you passed your Nclex, Nurse Lampkin? Let me know. Remind me. All right. So anyhow, pro-BNP is one of those things that you have to absolutely know. It is an essential lab value because it is connected to a very serious complication. Do you know what it is? All right. Do you know what the pro-BNP will be connected to? All right. Shout out from Hawaii. All right. I see you, Kit. Here we go. All right. What I'm looking for is I'm looking for somebody to tell me, why is the pro-BNP significant? Absolutely. If you have the Nclex VT, we have went over this. We have done it. We have done a whole lecture. And if you don't know, I like Faith. If you don't know, keep it real. She said, I have no idea. I have no idea what the pro-BNP is for. Hey, I'm not mad at you. All right. This is why we come here. This is why we studying, because you either know it or you don't know it. And if you can admit you don't know it, then you'll remember it. Okay. So I see it on the screen. Check out the comments because they are right. The ReMar nurses are on tonight. Brienne, congestive heart failure. Yes, The pro-BNP is so important because it will demonstrate fluid overload in your patient. All right. And here we go. We want to administer, it's number 4, the furosemide. We all know what furosemide does. It's a wonderful thing. It's a wonderful thing. We want to administer that stat because the patient has increased fluids, okay? Increased fluids. So the nurse needs to get the fluid off of that patient, all right? And you do that by giving a diuretic, okay? So yeah, if your pro-BNP is over 100, you have issue with fluid overload, and it's a really simple thing to correct if it's something minor. So like after I had Shiloh, you guys know I had Shiloh 3 weeks ago. I had so much fluid on me because I was given IV fluids during my labor, and I was in labor for like 2 days. So I had a pro-BNP of 190, right? And so I asked my nurse, I said, what are they going to do about my pro-BNP? He was not all that familiar with a pro-BNP. So anyhow, I ended up getting Lasix, furosemide, and I got 20 milligrams of Lasix, and I literally lost 10 pounds of fluid in 1 day. All right, so furosemide is a very powerful, very, very powerful diuretic. It will take the fluid off of you. So you guys say, yeah, I saw that in the VT. Yes, we go over these principles because they are so important. All right, so if you give a diuretic like this, you definitely want to check your patient's weight before you give it. Because once you give it, that fluid is going to come off. Woo! Easiest 10 pounds I ever lost. All right. All right. How about we do one more? Okay. How about we do one more? All right. Yes. Also, I tell the story of Mark's dad who had a pro BNP. So you guys know, if you study with me, I got a lot of stories. Okay. Let's do one more question here. I'm gonna see. Okay. I want to do that question. I'm going to do this question. I'm going to do another one too after this. But I'm going to do this question. All right, here we go. Question number 5. No, Salome, come here. All right, sit here. Okay, kids is popping up on me. Bear with me, y'all. All right, so number 5, which of the following would be the most important clinical finding of fluid volume excess in a client with chronic renal failure? All right, most significant, okay? Number 1, fluid intake greater than output, a weight gain of 5 pounds, fluid restriction, or edema +1. This is interesting. So what we're talking about here is what would be the most important clinical finding for a client with fluid volume excess, all right? And the patient has renal failure. So what are we going to lean towards as most important? Because they're all important, right? And that's the trouble with Nclex or your nursing exams. You look at the exam and all the answers are right. It's like everything is important here, but what is the most important? Yeah. So what I'm doing is now I'm pressing you guys, okay? I'm pressing into you to make you really think critically, all right? And we're trying to study while we keep our kids sleeping. We're trying to study and do as much as we can. All right, so what do you guys think? A lot of people are saying number 2. Some people are saying number 4. All right, what about number 1? Anybody care about number 1? All right, okay. Thank you guys for joining this Saturday night. Smash that share button. We're doing medical surgical priority questions. We're preparing for Nclex. All right. So here we go. The correct answer here. Welcome. It's the ReMar Nurse Study Group. You made it live. The correct answer is a weight gain of 5 pounds. That is the most clinically significant right now, especially for somebody with renal failure. Because are they going to be able to get that fluid off of them? Probably not. So if they have a 5 pound weight gain, that's an issue for us. And that is the most important, right, clinical finding. So you guys got that? Did you get that one right? Okay. Kathy said I'm giving my baby a bath. Okay. All right. So I was going to stop. I'm going to do one more question. I got to find... Let me see. I know I had some more here. And I want to find a one that I like. I really, really like. It's not that one. Let me see. Oh, okay. I'll do this one. All right. You guys ready? I'm going to do one more question, okay? All right. All right. Just because I know you guys are down for it. All right. I know you guys come down to study with me. You got them all right? Let's try this one. All right. Here we go. Let me move it a little bit. A newly graduate nurse is working on a psychiatric unit. She walks into a room and finds 2 bipolar clients having sex. What is the initial action of the nurse? Number 1, document the incident. 2, separate the clients. 3, tell the clients they should stop for safety. 4, call the multidisciplinary team for assistance. Okay. Here we go. What do you guys say? Okay. All right. Here we go. Here we have moved on. Come on. We moved on. Reset. Read this question. Tell me the right answer. Okay? Read this question and tell me the correct answer. All right, here we go. All right, you on a psychiatric unit. You know what psychiatric unit's all about. You know what we're worried about. You know what we need. You know what everything is, okay? Hey, everybody. Thank you for joining in. We're talking psychiatric nursing. We're talking about we walk in, we find 2 clients. Oh, man, what do we do? All right, you're a new graduate nurse. Are you worried about safety? What are you worried about? Put the answer there. Give me the rationale, too. You can't just pick one, all right? All right, here we go. Here we go. What are you thinking? All right. All right. The correct answer, okay. All right. I don't know. All right. No doubt. Diamonds is no doubt. Here we go. So the correct answer, you guys must have some psychiatric experience. I don't know. Y'all supposed to be new graduates, all right? The correct answer is definitely number 1, okay? So, hey, this is what it is. If it's consensual, 2 adults, this is not to be interfered by you as the nurse, all right? Clients on the psych unit, they have rights. They have the ability to have visitors just like everybody else, okay? Just like everybody else. And so Nclex absolutely is looking for the nurse who believes that she has the power to overstep people's rights, okay? All right, and that's not a good thing. So just because a patient, number 1, is in a psychiatric unit, that does not mean that they can be treated any old way. That does not mean they don't have a right to use the phone, to have visitors, to be in charge of their care. They most certainly do. Only people who have very limited rights are those who are on the psychiatric unit because of a court order. Otherwise, if you're in a psychiatric unit, yeah, you better ask them what they want for lunch. Like, yes, they get to determine who they spend time with. All right. They are adults. They don't come there to be told what to do. And so, there's a series on Netflix called Nurse Ratched, and I haven't gotten to it yet, but I believe that it takes place on a psychiatric unit, and I don't believe that the rules are followed there, right? So just as a reminder, if a patient is on the psychiatric unit, if they're mentally retarded, if they are, what's another thing? What's another condition? If they're incapacitated, we still have to, give them their respect. All right. We still have to give them their respect. And so I want you guys to remember that. All right. Kathy is pressing me for one more question. You guys. Oh, my goodness. Let me see. Do I have another one? Oh, here we go. All right. I want to show you guys this really quickly. It's a slide that I had did. So remember, adults on the psychiatric units, the rights that they have, even though they're on the psychiatric unit, they can keep all of their legal rights. They have the right to receive prompt evaluation and treatment. They certainly can be treated with dignity. They can refuse any kind of experiments or research. Let's see. They have the right to be treated by a doctor or a nurse. Okay. They have the right to have the least restrictive conditions as possible. All right. No restraints or unnecessary isolations. They can receive unopened mail and also make calls. Again, the bottom line, keep them confidential, respect their privacy. Okay. All right. So, this is what it is here. This is what it is on a Saturday night. All right. All right, I gotta go. Okay, this is what it is on a Saturday night. So after all of this, guys, all right, and I'll answer your general questions. Bottom line, content is king. I can't say it enough. All right, if you're rocking with me and you've gotten so many of these questions wrong or right, hey, evaluate yourself, okay? Because with the challenge of Nclex, honestly, there are 3 things that you have to do. There's probably 4 things I can think of. All right. But you gotta know this content. And when I say master it, I am not talking about memorizing it. I said that earlier. I'm talking about really making sure you know it, because once you know it, then you can apply it correctly. All right. You can apply it correctly. And that means not getting mixed up in distractors. All right. That means you're able to actually anticipate. When I start an Nclex question, usually I can anticipate where it's going. You guys have to be able to do that. When you read an Nclex question based off of the patient's condition or the information that they give you, you gotta know the direction you're going in. A lot of you guys can do that, because remember when we saw the cast, the person with the cast and it was too tight, a lot of you guys knew to make that connection to compartment syndrome. That's what I'm talking about. That's what you got to be able to do with everything. Person with a non-healing ulcer, you got to connect that to diabetes. You got to connect that to confusion, hypoglycemia. Their diabetes is uncontrolled if they have sores on their body. If somebody is missing fingers and toes, I know that you have a problem with your diet. I know you're diabetic, and I know you're not following your diabetic diet because you're losing limbs, because your sugar is too high. All right. And this is things that you get not because you have years of experience as a nurse, but because you know the content. All right. Because you know the content. All right. So, long story short, I'm telling you guys, listen, there is some things that you have to do, but I'm telling you the solution to finding out that content is going to be, shout out Lauren, where you been? Lauren, Nurse Lauren. All right. She just passed. She's asking about the party. All right.
Can you bring her on?
No, I don't think I can. Lauren, can you jump on?
Is there a live icon? Like a green icon?
No. Oh yeah, there is a green icon. Lauren, can you get on here real quick? Let me see if I can bring her on. I don't know if I can bring her on. Nope. Can't bring her on. All right. Anyways, so what I want to tell you guys is sign up at ReMarNurse.com. A lot of people are asking about the VT, but if you sign up at ReMarNurse.com, then you can know when I'm doing discounts, lives, events, all these things that I do. I need you guys to sign up because Facebook and YouTube and things like that are going to be not my main source to communicate with my ReMar nurses. All right, period. So when I do things like this, I'm going to be doing them and I'm going to be letting you guys know. So I need you guys to sign up at ReMarNurse.com. Just head over to the website, give me your email address. That's all I need. Okay. Also, what I wanted to say was we do have a party coming up for everybody who passed Nclex. We have a special gift for you guys. We're going to do a live and we're going to just celebrate you passing your exam because it's major. So I don't want you to miss out on that. People have been asking me, what is my email? What is my phone number? Let me see. I'm trying to answer. Put the questions that you guys wanted me to answer right now. I'll do questions for a little bit. People have been asking me, how do I get in touch with you? Our offices are closed because of COVID. So we don't have anybody in the office to answer the phones. The best way to get in touch with me is email, support@remarreview.com. And that's how the team will be answering all of your questions about the virtual trainer. I see people want to sign up for the VT or they want to renew the VT for $29. However, Team ReMar is going to help you do that, okay? Mary says the VT is amazing. Absolutely. I love the VT. I graduated 10 years ago. This is the best book to refresh it. And again, if you don't know what the virtual trainer is, you got to get up on it, okay? It is my program that I designed to help nursing students pass Nclex. Oh, y'all hear my baby? Okay, listen, I don't know. Renew the VT. All right, is it still on sale? Yes. So the virtual trainer renewal is still $29, which means if you have the virtual trainer, remember you get the first 90 days free. Okay, you get the first 30 days, not free, but included into your, you see how I get when she cries? All right, you get the first 90 days included into your subscription price. And then after that, it's just $29 a month. You can renew your virtual trainer at any time. Even if you stopped studying 2 months ago and you're like, okay, I want to give this a try or I want to do it for real this time, it's just $29, okay? All right. Yes, the Ohio State Board of Nursing, The Ohio businesses, I'm here in Ohio. I don't know what's going on there. They are out for lunch. It's very hard to get in touch with them. What is the virtual trainer? What is the VT? Oh my goodness. So the VT is my online program. Okay. It is where I put my nursing lectures. People were asking about the videos. All of my nursing lectures are in the virtual trainer. It comes with a workbook and it comes with quick facts. So this is your 24/7. This is your 24/7 access to my Nclex review. All right. So it replaced my old program. We redid the program. And again, go to ReMarNurse.com because really you can read about the virtual trainer and all of that stuff there. All right. All right. Also, let me see. Can you show us on the computer how to buy the virtual trainer? Yep. Yes, I can. Give me 1 second. Let me see if I can do it the right way. Let me see if I can start a new tab here. Can you help me? All right. This is my Facebook. Hold on. Uh-oh. Hold on. Can you do it? You going to do it on your phone? Okay. Hold on 1 second. So, I'm going to do it on my phone. But anyways, I'm going to do it right here because most of you guys are on the phone. So what I'm going to do, okay. So here's the phone. All right. So if you go to this here, which is ReMarNurse.com, okay, ReMarNurse.com, it'll bring you to the website. The same one you see, you can do it on desktop or you can do it on mobile. With the virtual trainer, you can assess it either way. Okay, so all you have to do is just scroll up. Remember, I want you guys to give me your email addresses for staying connected to me. Okay, all right. But if you scroll up, you can learn about the you can learn about the program and how nurses are passing and read testimonials of nurses who've been out of school for years. All right, for years. And you're able to get the virtual trainer right now for 40% off, okay? And all you have to do is click that sign up button right there, okay? And then once you click the sign up button, remember you're going to get the 3-month subscription plan, okay? And whether you're an RN or a PN, you'll be able to get it. Now you got to make sure you pick the RN or the PN version, okay? And Mark's mom just texted him, so that's that. All right. But the virtual trainer, you can sign up for it right now. All right, by going to ReMarNurse.com. All right. Okay. All right. Okay. Since I had the old version, do I need to purchase the new version? If you have my old program, I would think you would want to purchase the new one, particularly if you're a PN, because the difficulty level has changed, and also if you didn't finish the DVD program, I would say there's a reason why you didn't finish it. And so try the virtual trainer because it's going to challenge you and you're going to get the newest information. There's a lot of things in the virtual trainer that I didn't have in my old program. So you would still be responsible for that information. Okay. Yes, even if you had the virtual trainer, you stopped it for a couple months, you can still restart it again. Okay. All right. Does the VT include self-assessments to see where you are in for Nclex probability pass rate? So the virtual trainer has exams at the end of it, and it has exams all throughout the program. And you have to get a 95% or greater in order to pass the exams in the virtual trainer. So there is your accountability there. It's not a program that you're just going to click through. You actually have to challenge yourself. But we have a question bank which will give you assessment in order and let you know how strong you are in the nursing content. Okay. All right. So check out our ReMar. Go to ReMarNurse.com and you can look at our question bank if you want to do assessments and questions only. But I always suggest that after doing your virtual trainer, okay? After doing the actual virtual trainer, okay? When will the COVID restrictions change? When will the COVID restrictions change? All right, and I got my baby here, okay. Okay, so I have my baby girl here, guys, so I got to wrap it up. The COVID restrictions are going to be in place. Okay. the COVID restrictions are going to be in place until we have a solution for COVID. Okay, do we have her pass? No, okay. All right, so when you're a mom and you're a nurse, you got to be able to multitask, all right? So on a Saturday night, we got to do it all, okay? All right, so yes, guys, you will have the COVID restrictions and the modifications in place for as long as we don't have a solution for COVID, all right? So that is all I can say, and I think that's going to be a lot of the issue with our testing centers closed down, no test dates, all these things we have to keep in mind for when we're preparing for this Nclex, and I think that's why we really tried to make an effort to keep the prices really low. We have the $29 renewal for those of you who have had to have your test date changed, or you're going to be waiting till January. And you guys know I put a whole bunch of new information in the VT as far as the fundamentals courses go. And I'm going to be working on some new things for you guys as well to go into the virtual trainer just to keep you engaged, okay? It's very important. Hi there. Okay. All right. So that is that. Okay, guys? So I just wanted to hop on here. Thank you guys so much. I don't know when the Nclex is going to come back to normal again. I have 2 weeks to take my boards. Can I still purchase the virtual trainer? Yes, we've had students who have done the virtual trainer in 2 weeks. It's very aggressive. That's what I'm going to say. It's a very aggressive program. So if you're going to do it in 2 weeks, you're going to be studying probably 4 or 5 hours a day, every day. Okay. So you want to make that sacrifice, you can do it, but it is definitely good to have the content. Okay. Yes, if you paid $69 to renew it, that was the old renewal price. It can be changed. Okay, it could be changed because what typically happens is when you sign up for the program, that renewal price was $69, and then we discounted it again. So just let Team ReMar know. They understand, and they'll get you the $29 renewal price. Okay, so no worries about that. Just contact Team ReMar. Okay, all right. I see this question a lot. The average score in the question bank. Okay, so our question bank is 1,200 questions. It is $29, and I have been getting a lot of feedback that it's great. People love it, but it is very challenging. So the average score for the assessment is usually around 60%. I am typically not... I'm not a stickler for the question bank assessment because for me, what's more important is that you review the questions that you missed and go over those rationales, okay? So when you do the question bank, I would love for you to get an 80%, okay, on the assessment. But if you don't, what's more important to me is that you have the ability to go over those questions again, all right? That's more important to me, guys, okay? All right. Yes. It's fine. Okay. If you're taking Nclex next week, we will be praying for you. Okay. All right. Also, don't forget, please, to send me your email so that I can stay in contact with you. And will you be doing online class? I do classes online every Monday. To get the question bank, you go to remarnurse.com to get the question bank as well. All right, Mark, I'm going to give you back her. All right. Crystal says, will the program benefit me while I'm in school? Yes, we actually have nursing programs who have their students doing the virtual trainer their senior year. So if you want to get a jump start in your nursing studies, if you want to have the dots connected a little bit more than you probably get in your lecture classes, the virtual trainer is going to be great to help you do that. Okay. Okay, so I need you to go to the website and sign up on the website. Don't give it to me here on the live, okay? We also have the question bank is for RN and PN. Yeah, we have question bank for RN and PN, okay? So again, go to remarnurse.com, sign up, give me your email so I can stay connected to you because I'm going to start sending out notifications when I do live classes or things like that. Okay, guys? All right, I'm going to get out of here. Saturday night, we have been studying for I'm sure over an hour. I hope you had a good time. I sure did, going over those questions. I love studying with you guys. Thank you so much for all the support for the ReMar nurses, and to all of you who are new to our community. This is what we do. This is what we do. We study for Nclex. We pass Nclex because we can, and we will, and we must pass Nclex. Shout out to the virtual trainer right now. Go get it. If you don't have it, you got to get it. See you later, guys. Bye-bye.